All right. Thanks so much for being here today. I'm with Dr. Josh Wachspress out in Israel. And today we're talking about the SmartMirror and the company that Dr. Wachspress has built around that, and how you as an orthodontist can sell yourself as the product instead of selling brackets or just some other commoditized thing in the 21st century. So we're super excited to be here. Dr. Wachspress, thanks for being here.
Oh, thanks for having me, Keaton. It's a pleasure.
Yeah. So why don't we start out with a little bit of background on yourself? Tell us about your schooling, how you decided to go into ortho, and then how you ended up in Israel.
Sure. So through college, I studied mathematics. I was sure I was going to be an engineer. And then I spent a summer volunteering in a local hospital in Queens, New York. I spent some time in the medical, in the ER, and then some time at the dental clinic. I had an older brother who was in dental school at the time. Couldn't stand the medical part, but I really liked the dental clinic, which sounds a little strange. So I decided to go to dental school. Went to Stony Brook, then did a 1-year GPR. And in my 3rd year of dental school, I actually had orthodontics for the first time, and I was sold. I was hooked. After the GPR, I decided to apply. I went back to Stony Brook for a couple of years. Graduated in '98 from my ortho program, and I'd always wanted to move to Israel. Had a very religious, Orthodox Jewish upbringing, and Zionism was a big part of our upbringing. And I thought that Israel was the place for me to be. So I had a professor in Stony Brook. He said, "You're young and you're stupid. So if you want to move, just pick up. Don't start a practice. Don't become an associate. Just pick up and leave." So my wife, 2 infants, we got on a plane and we joined. We actually had some family living here already in Israel. So we ended up in a town called Modi'in, not far from Jerusalem. And I set up shop. I hustled for a couple of years, probably like most startup orthodontic offices, to make ends meet. Worked probably 5 or 6 different practices while I was trying to focus on building my own office. And over the past couple of years, I've been able to focus, thank God, on just my one practice.
Wow.
So that's how I got to Israel.
Great. And did you, sorry, just a side question here. Did you have any heritage or like things that made it easier to get a visa there, or was it purely a work visa that you started out on?
To get a dental license, there was, at that point, it was 2-part tests. So I had flown in during when I was in my orthodontic program. I did a didactic test, and then I came in also for a practical test. So I had to cut some class 2 preps and some crowns. It hadn't been that long since I was school, so I got through that. To get my orthodontic specialty license was a little more trickier. But once I finished my ABO certification, they sort of grandfathered me in. So that was great. So I did the ABO and got my specialty license here.
Good deal. And are you in Israel forever then?
That's the story. My wife and I, we're raising our 5 kids here. One got married. My daughter got married last year. My son's getting married next week.
Congrats.
I don't have just 3 more at home. I have a few in the Army. There's mandatory Army service. So the kids grow up with a tremendous sense of obligation, responsibility, and it makes the practice of orthodontics a little bit different, because my kids and my patients are all serving in the same Army units. So there's inherently, it's not that it's purely homogenous, but there's a tremendous sense of family. For better or for worse. Family can be a pain in the butt, and family can also be wonderful.
Very cool. It sounds like the dynamic. I mean, it sounds like you're living your dream, which is awesome. I'm so happy that your family's been able to make it out there. And
so that was the message that I got from the orthodontic faculty, is that you have your profession, you choose where you want to live, and you run with it.
Nice.
and you treat people well, and you'll build a practice. Doesn't
Very
matter if
cool.
it's East Coast, West Coast of the States, or somewhere else. Just
Hmm.
be a good doctor, treat people well, and they will come.
Very cool. And are there any, just because I think this will be relevant to our conversation about making the orthodontist the product that's being sold, are there any marketing stipulations or restrictions that you have in Israel that maybe an American or a Canadian doctor wouldn't have?
So publicity was frowned upon, I guess, sort of like in the 80s, 90s in the States. And then so
Okay.
the floodgates opened once the attorneys in the States started advertising heavily.
Hmm.
Here, it's not a big thing. You don't hear radio ads, or you
Hmm.
don't see TV spots locally for professional offices. But social media is
Hmm.
pretty heavily invested. People pay a lot of attention to the Facebook groups, especially for the moms.
Okay.
TikTok and things for the younger kids, for the
Hmm.
Gen Zers. I think it's starting now.
Okay.
But I imagine in a couple of years, whatever marketing techniques are happening in the States are going to make their way here too.
Got it. So it's definitely more similar than different.
Yeah.
Good deal. Great. So tell us about SmartMirror. How did you start the company? How long ago was it, and what does it do?
So I'll just put that out there. I'm the clinical director at SmartMirror,
Okay.
and we're blessed to have some great minds at the helm. Dan Harkabi is our CEO and co-founder. His partner Giddy, they were part of the team that brought the USB thumb drive. We call it here the disc on key to market.
Wow.
Back in the day. So they have a very successful history of bringing new technology
Hmm.
that's accepted worldwide and becomes indispensable. Probably about 6 years ago, I was at a Damon Forum in
Hmm.
Europe, in Barcelona. And I remembered some advice I had gotten from a family member. I had been taking a Dale Carnegie course when I was building my practice, just trying to learn all the business acumen that we got no exposure to in my orthodontic residency.
Yeah.
One of the messages that I got from Dale Carnegie was find people that are successful and talk to them and see how they became successful, and then model that. No reason to reinvent the wheel.
Hmm.
So I had a family member who was a successful businessman, and his advice to me was to basically be nice to everybody. I think it's just good advice in general,
Hmm.
because he said you never know who you're going to meet under what circumstances. So don't have a bad day. Just treat each person you meet as if they're a gift, because you never know what's going to develop from a new relationship. So at this meeting in Barcelona, I met an Israeli couple, Yael Harkabi, who is a very talented dentist, and her husband, Dan, who I didn't know at the time, but was a hyper successful high-tech entrepreneur. And over the course of time, we started discussing the pain that we feel in the dental profession, particularly in orthodontics, and how looking at what we do from a different perspective can lead to the next development, the next technology. There's a great quote from Adam Grant in the book Originals. I love this quote. He said, "Deja vu is seeing something new, but feeling that you know it, that it's something old.
Hmm.
Ujade," he said, is seeing something old in a whole new way and looking at it. And over the course of time, we pivoted a bit, but we focused on the dental mirror, which hasn't changed basically in hundreds of years. It's just this, or over 100, between 100 and 200 years.
Hmm.
And why not make the most ubiquitous tool in our armamentarium become our communication hub? Let 21st century communication, put it in the hands of the doctor at every visit. It's very powerful technology. And Dan and Giddy just had this gift of seeing things that other people don't see, and taking it to a whole new level. And it's, I think it's just going to revolutionize how we interact with our patients, how we treat our patients, how we see ourselves in our profession. Everything from ergonomics and reducing lower back pain and neck strain, because you don't have to spend your day adjusting an overhead mirror because you have, just so the SmartMirror has these LED lights, very powerful. To finishing the day with a great feeling of satisfaction, because when my patients can understand how hard we work, dentistry and orthodontics is really hard. It's super hard to focus on such a minute details all day, every day. And it's exhausting. When my patients have their great smiles and they sort of get how hard we work, the feeling at the end of the day, it gives you motivation to get up the next day and just do it all over again.
Very cool. So for those who don't know what the SmartMirror does, let's talk about the basic value proposition. What is the technology and what does it help on a day-to-day basis?
Sure. So let's start from the very beginning. SmartMirror, the ecosystem starts with the mirror itself. I'll hold it up. You have the mirror, which is sapphire, basically not that it's indestructible, but it's pretty tough. You can take a carbide burr to it and it won't scratch. It's surrounded by very powerful LED lighting, which are variable strength. We call it true lights, true color. So for our dental colleagues, it's great for shading. If the orthodontist is doing some composite restorations, there's a big movement now for the orthodontist to do some of those nice cosmetic restorations, whether it's bonding a lateral incisor or restoring an incisal edge. Sometimes we can probably even do it better than our dental colleagues. There's a micro imager. I'll hold it up here. I don't know if you can see that. There's a micro imager right in the camera. It has an HD medical grade, like an endoscopic camera.
Very cool.
The mirror itself has two components. You have the mirror, which is autoclavable. So this goes in the autoclave between patients, and the streamer, which has the battery supply, microphone for voice to text function. And let's see, it has the wireless as the Wi-Fi component. So these together make up the SmartMirror. The mirror itself then is integrated into a larger ecosystem, which is called the Edge, SmartMirror Edge, which is basically an Intel NUC computer, which becomes the hub for all the smart mirrors in a dental office. The SmartMirror can be used as a standalone. It can connect directly to an iPad. So by every chair, every exam room have an iPad. I have a bunch of smart mirrors. My staff know when I come in the room, SmartMirror is connected. The images are already streaming. I have in my exam room, I have tethered to the chair side iPad a large overhead screen. So it's very powerful messaging and relationship developing. When I do an exam, my new patient, I think, has probably between 2 and 4 minutes if they decide if I'm going to be their orthodontist or not. Within spitting distance, there's probably 3 or 4 other offices that people can choose from. In addition to there are public health clinics. So I have to stand out. I have to be the purple cow. When people come in, and I don't know if it's so much the parents, but the kids have to trust me. The kids have to believe that I'm the guy. So when I use SmartMirror and during an exam, we see together on the overhead screen exactly what's going on. We can see dynamic function. Patients can close their lips and swallow, and I can demonstrate, let's say, an anterior tongue thrust because of the integrated lighting. We can see centric slides. I can show them lower incisor wear because of the deep impinging overbite. And all these little things, I can choose what I want to focus on. And I do it for a minute or two. we can also, I capture images or a live video of that exam if I want to review it later on. And my TC snaps some images while I'm doing the exam and then airdrops them directly to either the patient or the parent's phone. So while I'm talking, while I'm explaining, they're already getting feedback. Because sometimes either mom's not here or dad's not here and they want to be involved. And maybe the parent that's not here is really going to make the decision whether they're going to come to my office or not. So from the new patient perspective, it's very, very powerful technology.
Yeah, very cool. Tell me, sorry, I'm not sure I fully understood that airdrop bit that you talked about. So it's recording, it's sending the video, or what is it sending to maybe the other parent that's not there?
During an exam, I'll record the whole exam. Let's say it's 1 or 2 minutes. But during that process, if there's something I want to focus on, we just take a snapshot, like a screen capture, and then we just airdrop that screen capture. I've also sent images or videos to referring doctors, to periodontists. If I see a low frenum pull, high frenum pull and lower incisor recession, at the first exam, we'll capture a 5-10 second video and just email that or WhatsApp it to the periodontist, and we get a consult on the spot. And time is important. COVID sort of brought to light how important it is to make sure that every appointment is worthwhile, that you maximize the value and benefit of each patient interaction. Yeah. When I can save the mom or the dad having to take little Johnny out of school again just to get a perio consult, when we can do it right then and there, that's value added.
Oh, huge value added. Huge value. It reminds me of, I had a professor in college who he wrote multiple books on influence, was a big sales, guru, and had gone around, spoken, given certifications, all that kind of thing. And he said when he coached doctors, a big part of the issue with giving a treatment diagnosis in the 21st century is that the patient can just go to Google and Google exactly what the doctor has just said and find 15 different opinions on the same exact treatment diagnosis or whatever it is. And so he, would coach those doctors on how to position themselves as an authority, how to have the soft skills in the consultation to help close the patient, get them into the treatment they actually need instead of going to Dr. Google. And what I'm hearing that SmartMirror can do is allow the patient to see that you're not lying, that exactly what you're talking about, and you can prove it with this live stream video directly inside of their mouth.
Yeah, Keaton, I agree 100%. I think patients are savvy and they can tell the difference between overt marketing and me just showing them what there is. Intraoral camera, still photos, take out retractors, that's marketing. But when we see it live, we're seeing it together for the first time, it's like you said, it's honest and it's real, and patients can feel that. Yeah. And I think it's our responsibility as orthodontic professionals to let people know that we're the best trained, we're the most highly qualified to take care of their orthodontic needs. Every dentist can offer clear aligner therapy or indirect bracket setups and not have to understand much about the underlying biology or growth and development, but that's where we need to shine. Yeah. Dan and I were recently at an Orthopreneurs meeting in Denver. Shout out to Glenn and Mike. It was a great meeting. Some of the lectures really made an impact on us. One in particular was talking about the impact of technology and how it's going to affect us in the 21st century. And the take home that I got was that any process that can be written down is going to be done better, faster, quicker by algorithms, i.e. clear aligner therapy. Yeah. And this very powerful message is that we can't let the orthodontist be cut out of the loop. We can't let corporate orthodontics go directly to the consumer, because it's not in the consumer's interest.
Yeah.
And the only way we can do that, as you said in the beginning, is to make the orthodontist the product. We're the value add for this whole process. We're the ones that motivate, educate. We care. An algorithm can't care, and an algorithm can't intuitively know what the best treatment is for a patient. And this is, I think, where we're going to hopefully bulletproof the orthodontic profession against whether it's corporate dentistry or at-home aligner therapy, or whatever that is, or general dentists performing orthodontics. We need to up our game, and that starts with communication. It starts with building trust and letting patients know that we have the skill set to give them the best result that they can expect.
Very cool. Sorry, did I cut you off there?
No, that's
awesome. Great. I just wanted to say yesterday, or no, 2 days ago, actually, my brother sent me this TikTok video of somebody who had ordered a 3D printer, ordered a dental, I forget what it's called, like a heat press, and had gotten a 3D scan, I assume through, Smile Direct Club or something, or maybe gone to a dentist and had them, or an orthodontist, and had them give them his scan. And he had created his own clear aligner therapy, and he was telling people to go ahead and DM him on Instagram, because he would go ahead, he would make their Invisalign for them, and it'd be much cheaper than what the orthodontist would do for them, which was
get some lightning strips, get the lightning strips at Amazon, and you're good to go.
So anyway, I watched this, and I sent back to my brother, like, there's no way the trays are going to fit after the fourth tray. Like I've heard millions of horror stories from aligner clubs who have said, they've come to the orthodontist and said, here are all these aligners, none of them fit. And that's from, a quote unquote reputable company, somebody with, millions of dollars of funding that's publicly traded. And this other guy out of his basement thinks that he's going to do it successfully. But the point isn't whether or not that is successful. The point is where that puts an orthodontist who went to years and years of school and has that knowledge, like you said, and the can intuit exactly what a patient needs, and is an expert in orthodontic treatment and clear aligner therapy or braces or whatever it happens to be. Another example, just to show this happens on a macro level and not just in orthodontics, chiropractors, people can look up how to do a chiropractic adjustment on YouTube, and 15 minutes can make the bones crack. Doesn't mean they're doing it right. But in the consumer's mind, they say, I know how to do this. I don't need to pay the expert anymore, because of this dissemination of knowledge that's happened. And so I love what you're saying. It's truly a futuristic take on the market, because I don't think we're fully there yet. But the more and more we spend time in the metaverse and just, YouTube and TikTok and all of these social media platforms disseminate knowledge so quickly to everyone, the more we're going to need differentiating factors to make us successful, or make the doctor successful. So tell me, next question I have is, what have you seen the minute you introduced the SmartMirror into your practice? Did you notice your closing rates going up? What have you noticed in the consultation that's gone differently from the patient's perspective? Are they quite impressed every time you come in? Tell doctors about that.
So I'll get to that in a second. Just want to go back a second to your brother.
Yeah.
I'm assuming he's a handsome, educated guy like you.
Yeah.
And I was reading some analysis on who the direct to consumer, who their clientele is. Was focusing on in New York City, I think in the Upper West Side, and these are educated people. These are professionals, and their interest. It didn't sound like it was so much saving money. It was really saving time. And as we know, sometimes the thing that saves you the time ends up costing you the most. I think it goes back to our obligation as the orthodontic professionals to just let the public know that they have to come to us. We're the ones.
Yeah.
In terms of analytics in my office, unfortunately, at the very beginning of my SmartMirror experience, I had one. I had one SmartMirror because that's all there was. There was one in the world.
Yeah.
Actually, there were two. Yael, Dan's wife, had one, and I had one.
Nice.
So the first step was for my TC. We took some time. We did some clinical training in terms. It's actually pretty simple. The app you download from the App Store, it's really intuitive. But from day one that we started using it, patients sit in the chair, they see the screen, they see the big screen on top. Our same day start or closure rate went up by about 12% during the first 6 months that I was tracking. So in terms of ROI, that's incredible. But then once I was able to get a few more SmartMirrors, as we started to ramp up the production. By the way, I had to fight because we had some obligations to send some units to overseas, so I had to wait my turn until we started getting some units available. But now I have one in each chair, and our clinic protocol is we don't use it at every appointment because some appointments in orthodontics is just 30, 40 seconds in and out. We use it at every retainer check. We do a lot of bonded retainers. When I first came to Israel, I wasn't a big fan of bonded retainers. Like a lot of orthodontists, I don't want to be married to the patient. I want them to take responsibility. But as we had talked about, our teenagers, from the ages of, let's say, 18 to 22, if they're in their military service, they may not be able to put the retainers in on a regular basis. So the bonded retainers became sort of de rigueur. That's we needed to do. So the hygienists, the first thing they do, they turn on SmartMirror and they examine the bonded retainers. And I can't tell you how many times they've come to say thank you, because they were tired appointment after appointment, month after month, year after year, just saying the same thing over and over again. Got to brush better. You got to go to the hygienist. We have to repair the bond here. Here, the wire's broken. They just turn it on. The patient sees the screen, and in a second, the patient gets it. They know they have to go to the hygienist. They see the calculus buildup. They see the broken retainer. And because of the magnification, it's probably about 10 to 12x magnification with the imager. We're seeing things before they become a clinical problem. My staff has caught microfractures of a bonded retainer before the teeth start to drift. And then we can address that problem before it becomes a big issue. Wow. As we say, we want to talk less and smile more. That's our motto these days. For bondings, it's incredible the light that gives, especially when you're bonding upper second molars. Before we cure I place all the brackets. My chair side cures them, but before she cures it, we check and we make sure there's no flash. Is the number of brackets that I've popped off in my career trying to clean out the flash under the hook of an upper second molar. It just makes me sick to think about it. Yeah. So now we were able to see those little details before we cure the brackets. For routine arch wire checks, the staff, the chair sides, they check to make sure there's no TMA sticking out 0.5 millimeter. The patient's going to come back to because of sore cheek. When we give elastics at the first appointment, we make a short video using SmartMirror, and we again either airdrop or email that 5 or 10 second video, and the patients can see how they put the elastics on. Patients can see where the hygiene problems are. It's amazing communication, especially when we were sort of in a lockdown during COVID, and we had to really limit the access of the parents to the office. Drop the kid off. We're masked, gloved, gowned. It was a terrible time, but we will still want to have that line of communication open, because the parents need to trust us, and we need to get our we need to get the information back to the parents. So SmartMirror was a tremendous help in terms of not having to run out to the parking lot and tell mom or dad what's going on. We just take the video, email it, boom, they're on their way. So compliance has gone up. It takes off so much of the pressure from myself and my staff. We don't have to talk and say the same thing over and over again. We just show, we smile, and the patients get it.
Very cool.
It's a lot of stress off.
Yeah. What I'm hearing is, there's three ways to grow any business. You need new customers, or you need to sell more to your existing customers, or you need to reduce the costs that it takes to sell to those existing customers or the new customers. And what it sounds like is that SmartMirror is really helping you with that third one, to reduce emergency appointments, reduce other appointments, that my cheek is having issues because we put the bracket too close to it. All of those things have been shrunken down because of SmartMirror, as well as your closing percentage going up.
And not to discount the value of both internal and external marketing. In my community, external marketing probably not as effective because the business model where I am, most people go to, let's say, public health funds that offer discounted orthodontic care. So we have a very small slice of the orthodontic pie where people will pay out of pocket for private care. So the internal marketing aspect of SmartMirror is probably the most valuable in terms of increasing our bottom line in terms of our revenue, aside, and obviously the 12% bump in same-day starts. But for social media, which I guess is the combination of both internal and external, you're the expert at this. I'm a bit of an older generation, so we're still stuck in Facebook. Although our consultants are trying to push us a little beyond, is that there are great images that we capture with SmartMirror at a very low acquisition cost. This is another point. Instead of taking out the camera, either DSLR, even your iPhone, retractors, and a mirror, now we just press on the iPad, press image capture while we're using the SmartMirror, and we have the image. And it's easy to file. Instead of, let's say, 2 to 4 minutes of staff time just to capture an image, and then have to take out the card and upload it to the computer, the acquisition cost is zero. It's really just pushing a button. The images are amazing. We don't use it for full face photos, but I can capture an arch, let's say an occlusal photo, and it can really help me document from appointment to appointment if I'm closing spaces with TADs or whatever it is. I just capture the image, it gets filed, and I can very simply follow the patient appointment to appointment. For our clear aligner therapy, I almost said Invisalign, but I'll say clear aligner therapy. We capture a video at each patient exam. So if I see that teeth are not tracking, I can then go back and look at the video, and the detail is incredible because I can see which attachments are off. I can see which attachments are not tracking well. And I think that helps me diagnose and design a better ClinCheck or clear aligner therapy for the next setup. Very
cool. I think from a social media perspective, I'm just thinking through like my clients that I want to tell about the SmartMirror first of all, but there's so much differentiation that you can provide with this technology as opposed to other technologies. There's a lot of doctors that nerd out over their iTero scanner, love iTero scanners. They nerd out over their 3D printer, whatever, and it's cool. And a percentage of your patients are actually going to be interested in the fact that you have the latest technology. But when you start, there's a technical term for this actually called technobabble, when you start talking about the technobabble to your patients, it's actually the number one sales killer. And if you're selling, let's say you're selling weight loss program to somebody, and you start talking about all of the different things that cause weight loss and all of this technobabble, or let's say you're selling pest control to somebody, and you talk about all the technobabble when it comes to pest control. That's not what people need. They need just the transformation to be sold to them. And what the SmartMirror does is allows that transformation to be seen instead of said. It's like a tagline I heard once for a video capturing software. It says, send a video, not 1,000 words. And it's what I'm trying to say is it's technology that actually matters to the patient, where all the other technology helps them get a better result. But at the end of the day, they care about the result. The SmartMirror can help them see that result and can help you document that result better and the process of getting that result better. And I think on top of that, just having the SmartMirror, like just putting it in a picture or in a video and, sending a sponsored ad out to a local area and any of my clients' areas that I'm thinking of right now, I'm 100% sure would bring in new business to them, just because this is, I mean, if you made a TikTok about how this works and how the SmartMirror functions and how you can see everything behind your teeth,
What's
guaranteed.
That thing? What's what?
TikTok.
TikTok.
You talked about it. Sorry, I'm not. But you make that TikTok and you send it out. I'm 100% sure it would go viral because the technology, like you said, you're reinventing something that's so old that people have never seen a new version of it, and bringing that out, I'm sure has also contributed to word of mouth referrals for you. But it's just that slight, it gives you an unfair advantage over your competitors and over the corporate dentistry takeover because of how amazing, just simply the clinical photos, the transformation you're able to document and show through it.
Sure. In general, I think my life attitude is that I think we should all be in a level playing field, except for this.
Mm-hmm.
I don't mind having an unfair advantage. But there's, I think, two things I'd like to touch on about what you just said in terms of on the human level.
Mm-hmm.
One is that I think every orthodontist has their own personality, their own style, how they sell, mm-hmm. how they want to present themselves. If they're serious, they're goofy, they're the clown, whatever their personality is, whatever works for them. And I think one of the cool things about SmartMirror is it really lets me, Josh, be me during the exam. And it's not dry, it's live. Mm. And it lets me sort of magnify what I can offer and how I want to offer it. Mm. Not that I'm a perfect match for every patient, and every patient's not a perfect match for me. But it lets the patient sort of get an inkling of why, what motivates me, what's my why. Mm. And my why is that the patient should have the smile to tell their story. I can tell my story when I have SmartMirror during my first exam, but I can't help them tell their story unless I can treat them. Mm-hmm. And with SmartMirror, I get to tell my story, and hopefully I can help them tell their story. And the second thing I want to talk about is in terms of patient management. I have a number of special patients, mostly, let's say, with Down syndrome. And there's a spectrum, and some are easier to treat and some are harder to treat. Mm-hmm. But the iPad is a world that these kids know, and they're very comfortable with the iPad. Yeah. So during bonding, during adjustment appointments, we give the kid, let them hold the iPad in their hand while we're treating them. Mm-hmm. And they get a show. They see what's going on. And it's the point where I won't treat those patients if something's wrong with SmartMirror, like for whatever reason, let's reschedule that appointment until SmartMirror is available. And I assume, like most of our colleagues, we're seeing a lot of more patients on the autistic spectrum.
Mm.
And there's something I would even call magical about letting these patients become involved and engaged in their treatment.
Mhm.
But that's not a financial thing. That's us being good doctors.
Yeah.
And sometimes it's really important to get back to why we do what we do. There's great benefits. We as a profession, we have a great lifestyle.
Mhm.
Uh, but bottom line, we are here to help our patients and we're here to serve. And a child that can come in and doesn't need general anesthesia, doesn't need special care, but they can be treated because they're more comfortable, they're more relaxed. That's a very special feeling at the end of the day.
Very cool. And I want to touch briefly on general dentists or even pediatric dentists and what they could use SmartMirror for. I assume just as you mentioned, your patients with special needs, kids with anxiety going to the dentist, it's like a tale as old as time. And I feel like it would apply directly to them as well, correct?
Oh, absolutely. Dan's wife, Yael,
Mhm.
in her community, she's known as the doctor with the magic mirror. And if I had a 12% increase, I think she's had like a 200% increase
Wow.
in new patient calls.
Wow.
People call her and say, "Are you the doctor with the magic mirror?" Because the kids come and they don't mind sitting down and having dental treatment, and that's a gift.
Wow.
It's very, very special.
So cool.
Uh,
And then general dentistry, what are some use cases there?
Personally, I don't perform any general dentistry,
Yeah.
but on our Facebook group, our advisory board has a number of general dentists, and they're reporting that they can sell their heavy crown and bridge cases much more easily because patient sees what there is, and it's easier to help them get the dentistry that they need.
Mm-hmm.
And from an analytic perspective, if let's say 30% of a GP office revenue should be coming through their hygiene program, hygienists using SmartMirror and the patients seeing like the old cruddy, MODBL amalgam that's been in their mouth for 30 years, they want to change that to full coverage. They want to change that to beautiful white with zirconia, whatever there is. So this is a way to help the patients really get the dentistry that they want.
Mm-hmm.
And it's maybe not so much our obligation or the dentist obligation to tell them patients what they need, but let's give our patients what they want. They may not need to redo that crown, but there may be a big benefit, before they shear off a cusp. Let's not wait until the fracture's below the gum line and then we'll take out the tooth and put an implant in.
Yeah.
Let's give the patient full coverage and let's protect those teeth. We can see incipient caries. This is what I'm hearing from a dentist I've seen in my office. Things are a little shady, and I refer them back to the dentist. They said, "Yeah, good catch. You can use the SmartMirror actually for transillumination." Just speaking with a pediatric dentist, and she said slip and fall trauma, and the way she diagnosed the problem is the transillumination with SmartMirror. Just during an exam. There are a lot of benefits here. You can document for insurance companies. And in terms of that, we have a pilot program here in Israel working with one of the larger dental insurance companies where SmartMirror, the SmartMirror cloud server integrates directly with the insurance company. So claims are made online. During the exam, the doctor dictates, tooth number 12, MODBL. That voice to text is put right into the patient file. The software makes sure the patient is eligible. The images are captured and sent for quality control. Make sure that the procedures are being documented, that the procedures are being done. The doctor is getting reimbursed immediately. It's a pilot program that we're running here, and I'm sure this is the way that reimbursements are going to happen instead of filling out forms, sending in the X-ray. So there's a whole different, a lot of levels in terms of where SmartMirror is going to be. I look at SmartMirror now. It's my iPhone 3. I think it was 2006. I traded in my Motorola Razr flip phone for my first iPhone 3. And it was garbage compared to what we have now. But back then it was an iPhone 3 and it had a screen and I could use Log Me In and see my office software. It was incredible. So this SmartMirror today is the iPhone 3. We have, I think it's 18 or 16 patents.
Wow.
And whoever wants to see where we're bringing SmartMirror, you can just take a look at the Patent and Trademark Office. Some really interesting things in terms of making dentistry fully digital. And there's a lot of benefits coming down the road. One thing I will say is that it's not like you plug it in and you're good to go. Like any new technology, it takes some time. It takes some training of your staff. We're very much creatures of habit. In dentists and orthodontics, we find something we like, we run with it. We have, as a profession, we have tremendous inertia. It's really hard to get us to change something. Something's got to be really super special for us to change how we do our system. I think for young docs, I think for new grads, it's a bit of an easier pill to swallow, because they grew up, unlike me, they grew up with digital. They grew up having powerful computing in their hands all the time. And you mentioned iTero. I have one iTero. iTero is expensive. It took my staff a number of attempts. I don't tell you how long. I think our first scans were like 25, 30 minutes long.
Oh, wow.
It was insanely tedious. And they're saying, can we just take the PVS impressions again? We're going to use this because I just dropped 40 grand. We're going to use iTero. Now we're down to the 2 to 4 minutes per scan, but it takes time. So any new technology you bring in, give it a chance. It's not going to be where you want it to be, but it can grow with it. From the moment you plug SmartMirror in, it's a mirror. It has great lighting. And then once you realize it's a mirror, then you can start to use the next level of function, which is the imaging, the magnification, capturing images. And every orthodontist can decide how they want to integrate that technology and how far they want to bring it, to what level. So there's a sort of a comfort level for every office.
Yeah. And that this segues right into the other question I wanted to ask, and then we'll wrap up here. But what, for the skeptics out there, what does your technology team look like, and what could somebody that buys the SmartMirror today expect as far as software upgrades or hardware upgrades, or how fast are you innovating, and what does that team look like? And are the doctors going to be happy right out of the gate, but hope that there's more features soon? Or are they going to be super impressed and it's fully usable today?
So that's a multi-level question, and I'll start with the basic. There are different levels of smart. Like once you're in dental school, you're with smart people, and once you get to orthodontic residency, you're with the smarter of the smart people. The technology guys and the SmartMirror team are so incredibly gifted and smart that it just blows me away. Their ability to really analyze and dig down and get things and understand where our pain is. I took a stab at writing a patent. It's insanely difficult to write a good patent. So our patent guy is just the Shakespeare of writing patents. It's a beautiful thing to read.
Yeah.
In terms of support, we have local US support based out of Chicago. Software is updated automatically. The app is updated, I think, however many times they update the software. That's all done automatically.
Yeah.
The hardware of the mirror is, I think it's static, but it's the software that's the key.
Yeah.
In terms of service, I think the only thing that could really go wrong is if you drop the mirror on a hard floor, the mirror can crack. And then there's I'm for sure there's within days, like low number of days, you'll have a new mirror to swap out.
Very cool. It reminds me of a guy I heard that he bought a Tesla, and when he bought it, he felt like the software just wasn't up to snuff. It was clunky, all this stuff. And then he saw Tesla push a software update and immediately bought like $1 million, $2 million of Tesla stock the next day, because he saw how amazing the ability to take a piece of hardware that's quite good and pair it with the software that you can automatically push out updates worldwide with. And he saw the direction the company was going. So anyone listening to this, you've got your Tesla of dental mirrors right here.
So that's where we're going. Put a supercomputer and cloud computing
in
the hands of the orthodontist and dentist at every appointment. And I don't think you have to use your imagination too much to see where it can go.
Very cool.
And we're just getting warmed up.
Oh, yes, absolutely. Well, very cool. Anything else you'd like to say before we close out today?
You know what? I'd like to thank, first I want to thank you so much. It was really a pleasure. It was really a pleasure meeting you. And over the past couple of years, I've been sort of drawn out of my clinical practice. I was really head down to the grindstone, trying to figure out how to be an orthodontist and how to run my practice. There is a whole other world out there. And it's really fascinating. I love what I do. I wouldn't trade it for the world. I love the contact I have with my patients. I love the difference I have in my life. And I think this is my personal opportunity to sort of give back to the orthodontic profession. Not that I know anything about coding or circuit boards. I know nothing about that. But the people that I've met and the products we're helping to develop, this is really going to change how we practice orthodontics. And I'm just so proud to be part of the team.
Absolutely. That's great. And if anyone wants to go get a SmartMirror, where can they find you, and what does the process look like?
Okay, so they can go directly to our website, which is smartmirror.dental.
Great.
You can join our Facebook group. You can send me an email. I'm josh@smartmirror.dental. Keaton, I hope you'd be able to put our contact information
Definitely.
up.
Absolutely.
And it's an online ordering system. They'll ship it right out to your office. I would recommend to start slow, baby steps. Keep expectations realistic. Again, it's new technology. And like any new technology, whether it's, like you said, it's a scanner or the soft tissue laser, you have to sort of learn how to use it. It works. And as you grow more adept at using it and managing it, you'll grow, and the technology grows with you.
Very cool. Thanks so much, Dr. Wachspress. Great to have you on.
Take care. Thanks so much for having us on.
Bye.